Hello, and thanks for tuning in to part two of price determinations and negotiations for medical technology. My name is Franziska Merkel, and I am a reimbursement and regulatory specialist for diagnostics within the Small Business Education and Entrepreneurial Development, or SEED office. As part of the conversation on who purchases and pays for medical technology, we covered in part one insights into how payers manage the price for medical technologies, as well as when and how price negotiations occur. We started off part one by going over the key reimbursement strategies or strategy elements, coding, coverage, and payment. More specifically, we focused on payment. And we talked about price payment tools or price management tools and how payers use legal contracts conditions, coverage policy, utilization management, and coding to manage medical technology pricing. We also covered factors impacting prices, which includes products already on the market, contracts healthcare systems have with preferred vendors, and whether a healthcare provider is considered a network. Also, we covered employers' preferred insurers. Today, we will cover what everyone is probably most interested in. What prices do payers use and how are they actually derived? Coming back to the three reimbursement strategy elements, coding, coverage, and payment, we will again anchor our conversation around payment and specifically payment for the service or product. In other words, pricing. For this section, we will cover what prices payers use to pay for medical technology and how these prices are determined. So let's walk through it step by step. Prices are actually determined based on rates. While it is very important to understand the unit cost for your innovation, payer prices are generally set based on the rate the Centers for Medicare and Medicaid Services, or CMS, specifically Medicare, sets for the specific product or service. And based on that rate, other payers set their own rates. So if we use that knowledge that the Medicare rate is used by other payers, may it be public or private, we can say that the rate is sort of our base at 100%. One of the reasons is that for established products, CMS has a so-called fee schedule where you can look up the rate for each product or service based on a code. More on that later. As an innovator, I highly recommend that you compare the Medicare rate for your medical technology to the cost of your product to get a better understanding of the break-even point. Now, looking at other public payers, Medicaid and the Veterans Administration, or VA, also use the Medicare base rate. Medicaid generally set their rate at 70% of the Medicare rate, and then the VA sets it at 40% of the base Medicare rate. Quite a range, right? Now, we are shifting to private or commercial payers. They, on the other spectrum, set their rate generally at 120% of the Medicare base rate. Now, you may ask how the Medicare base rate is determined. Well, Medicare sets its rates based on providers' historical costs. So what does that mean and how does it work? So here we are looking at an example of how these rates are set, which is roughly a 4-year process. Yes, you've heard correctly. And this example is starting in 2017. When medical services are provided to patients, providers submit claims to insurers. They also create a profit and loss statement or report. The following year, in this case 2018, the provider sends the cost report to CMS, and CMS then has an opportunity to reflect on the provider's profit and loss statement incurred in 2017. In 2019, CMS then analyzes the cost reports and based on that proposes updates to the codes and rates. Stakeholders do have an opportunity to provide comments on those new proposals, and based on those comments, CMS incorporates those into the proposal and then finalizes it. And lastly, a new rate goes into effect. And that's why we say it takes time for this process to catch up, roughly 4 years. And this is especially the case when a new technology enters the market. Lastly, I wanted to make a plug for another module on navigating CMS fee schedules. So what are CMS fee schedules and why are they important? In the earlier slide, we talked about how rates are set, specifically the base or Medicare rate. So how can you find out if there is an existing rate for your medical technology and where? That's where the Centers for Medicare and Medicaid Services, or CMS, fee schedules come into play. Per CMS, a fee schedule is a complete listing of fees used by Medicare to pay doctors or other providers and suppliers. It is a comprehensive listing of fee maximums, so that is an important point. These are fee maximums that are listed there, and they are used to reimburse a physician or other providers on a fee-for-service basis. CMS also develops separate fee schedules for physicians, ambulance services, clinical laboratory services, and durable medical equipment, prosthetics, orthotics, and supplies. On this slide, you can also see where on the CMS website you can locate the fee schedules. So please tune in to the module on navigating those fee schedules to learn more on that topic. This concludes part 2 of the Price Determinations and Negotiations module. I certainly hope you learned something new, and if you listened to part 1 of this topic, we had talked about price management tools and factors that impact pricing. Here, in this module, we had talked about price and rate determinations. We said that these rates are tiered and directly connected to the Medicare base payment rate. We also talked about how these Medicare rates are set and that they are based on providers' historical costs. Commercial or private payers, employers so to say, usually set their rate at 120% of that rate, of that Medicare rate. Medicaid, on the other hand, sets it at 70% of that Medicare rate, and the VA, Veterans Administration, sets it at 40% of that rate. Lastly, we touched on CMS fee schedules, which are a complete listing of fees that Medicare uses to pay doctors and other providers. And those listings include fee maximums. You can learn more about that in a separate module, and I certainly hope you tune into that. And if you still have questions after listening to this recording, you can always reach out to us and request a consult with someone from our team.